A lot of people suffer in silence when it comes to problems with pelvic health. The founder of Urospot, Erin Craven, joins us now with more. And let's start out with what pelvic health problems could be. It could be a number of things.
It can be, yes. And it impacts the majority of women. So in our lifetime, at least 1 out of 3 women will struggle with pelvic health challenges. And as we age, that increases. So by 40, about 2 out of 3 of us are struggling. And these present themselves like those bladder leaks when you laugh, cough, or sneeze, or
Exercising.
Overpowering urgency. So you come home with your groceries and you're like, I have to go to the washroom this second, drop everything, or you might leak on the way. Frequency, going to the washroom like every hour during the day, waking up at night to go to the washroom, and pelvic organ prolapse, which happens to 50% of women once we're over the age of 50.
Because pregnancy causes some problems, menopause can cause problems.
You got it. There's so many stages of life.
And men also have bladder leak urges.
Yes, men struggle with pelvic health challenges as well. Urgency, frequency, waking up at night to go to the washroom, which is called nocturia. And men who've had prostate cancer are usually really struggling with these challenges after they've had their prostate removed.
Okay, so Eurosspot features this device, and is it called the Eurosspot, or is that the name of the business?
So Eurosspot is the name of our business, Euro like urology, and we are a place where pelvic health is done differently. And our care model for people involves technology, plus health coaching, plus education. And the technology, everything we do at Eurospot, you remain fully clothed. So nothing's going inside your body, nobody's touching you, your clothes are never coming off.
Okay, and it's the therapy is basically sitting in this chair, and it's based on it's doing Kegels, but you're not doing them.
Right.
The chair is doing it for you,
so,
essentially?
Yes, the chair is, it's like a magical chair, but you sit on this incredible Health Canada approved, FDA approved medical device, and it is a chair, and it uses high intensity focused electromagnetic energy. That's a long medical way of saying that we're sitting on a giant magnet. And magnetic energy actually moves through the chair, through your clothing, and it stimulates your pelvic floor muscles. So it's contracting that muscle over and over again at a rate and an intensity that you and I could never do on our own. So the energy used would be the equivalent of doing like 11,000 contractions of that pelvic floor muscle.
Okay, and like, what do you feel when you sit on it?
Yeah, it's amazing. So there's no pain. It's a little bit intense. It's just a strange feeling because, again, these are invisible muscles. You know, we can do exercises for our arms and see our bicep and know we're strengthening it. The pelvic floor is really hard to know, am I really engaging this properly? So it feels intense, but not painful at all.
Right, and do you need a doctor's referral to use the chair?
No, so everything at Eurospot is self-referral. And, you know, for women, they tend to struggle for about 6.5 years in silence before they decide to go seek help for these problems. So we're always encouraging them, come in. The consultation is complimentary. You'll learn so much. It is self-referral, and then decide if you want to move forward with treatment for yourself.
And part of it is covered through some health benefits.
Yes, yeah, we're partially covered through physiotherapy benefits because we are an interdisciplinary team and we have physiotherapists on our team as well.
Okay, so why, like, I'm looking for the science behind this. Does it work? Why does it work?
Yes. So to be approved by FDA and Health Canada, you always need to have clinical studies, and there's numerous for this technology. And electrical muscle stimulation has been around forever in terms of how that works for strengthening muscles. This is kind of a new way to apply electrical muscle stimulation in a very more intense manner to the pelvic floor. And so through the clinical studies that they've done, they showed that 95% of those treated reported a significant quality of life improvement. So for you, that might be sleeping through the night, or for me, that might be jumping without leaking, whatever that quality of life improvement is that you're seeking. And then 2 out of 3 eliminated pads or significantly reduced the use of pads, which is major. I mean, one pad takes 800 years to decompose.
Okay, and how long does the treatment take, and how many, like, are there people that may have treatment for a very long time? So
the course of therapy at Urospot, we see you twice a week for 3 weeks. So you have 6 appointments with us, and then there's a follow-up. And then what we recommend is you do a maintenance appointment. Your body will tell you when. For me, I do a maintenance appointment once every 4 months. For some people, it's once every 6 months. But that's just, think about it going to the gym for your pelvic floor. I'm just going to give that muscle a boost so that I can stay independent longer.
Okay, and how long do you sit on it?
you're in the room for about 40 minutes, you're on the chair for about 28.
Okay, and you're opening up one in Hamilton. You've got one in St. Catharines
We're
now?
opening in St. Catharines this week, and we're opening in Hamilton soon, and we have another 20 locations across the country.
Okay, we'll get all the links up on our website, chch.com/morninglive.